Good afternoon, folks. This is Rob Chappell, Executive Editor of Madison365, with your daily update for today, Thursday, July 22nd. First of all, we have to acknowledge a sponsor of today's update, the Log to Lose program. Do you want to have more energy? Feel stronger? That sounds good to me. The University of Wisconsin is enrolling individuals for an 18-month research program focused on helping people build habits for a healthy lifestyle. Everyone who participates will receive a well-researched weight management program led by registered dietitians. Go to log2lose.com for more information. And we appreciate the University of Wisconsin and their support of the update. All right, let's talk COVID for a minute. Then we'll have some local news. Then we'll have a break. On the other side of the break, we'll welcome Nusaiba Mizan from the Green Bay Press Gazette, who's done some really good and important reporting on homelessness, on affordable housing in that part of the state that I think you'll enjoy knowing. Now, COVID today. We're looking at 342 new confirmed cases, which is down slightly. That's it jumped on Tuesday from 107 to 451 new cases. Then yesterday was 359, and today is 342. So the raw number of new cases reported each day is coming back down slightly. 342 is still very high. We haven't seen anything more than 300 since middle of May. Okay, so it's been a couple months that we've been in that 100 or less range. Today we're at 342. More troubling to me, the positive test rate. That's the kind of the key number we look at, right? We don't look at any number by itself or in isolation, right? But that positive test rate, we've been saying for over a year now, we want it to be below 3%, right? 3% is kind of the threshold. You remember, I don't remember when now, months ago, like 6 months ago, the city of New York had opened schools because they were doing well. New York City had opened schools, and they said that if it gets up to 3%, we got to close schools again. Right? That's how important that 3% threshold is. Today, our positive test rate is 3.0%. A couple months ago, we were very happy about 3% because we came down from our high of 17, right, all the way down to 3%, and that was great. We were happy. Now, we're less happy about 3% because we're coming up to 3%, right? A couple weeks ago, we were at 0.7%. So that's why is that important? It's important because if you get above 3.0%, that means you're losing control of the virus. We're losing control of the virus because of the Delta variant and because we're not having enough people vaccinated. That's what it comes down to. Like, we were able to kind of maintain some level of control over this virus back in last summer because of mask mandates, because of distancing mandates, because of schools being closed, and of course in the summer school is out, right? And business being closed, restaurant capacities being restricted, a lot of restrictions on our lives. And we were told that we could flatten the curve, remember that? And that we could, we have to restrict our lives, have our lives restricted by the government, which ultimately ended up not working out because the Supreme Court said the government can't do that. So a lot of us restricted our own lives until we could get a vaccine. And then once we get everybody vaccinated, we can go back to normal. It's just that very last part that we haven't done yet, that get everybody vaccinated, right? We have the vaccine. We restricted ourselves. We restricted our lives. Government restricted our lives for a year, about a little over a year. So we got the vaccine, which was going to be our means to get control of it. And we only got halfway there. So now we're losing control again. Because the lack of vaccine has allowed Delta variant to thrive. So what does that mean? That means we got to, it doesn't mean anything from the government perspective. The government's not going to implement any new restrictions. Schools are not going to close. It's just not going to happen. We'll get to the news in a minute, but Madison schools did announce that the masks will be required. A Lots of places they won't be. Delta variant does seem to be able to affect children more than previous variants. Children cannot get vaccinated yet. You see the problem, right? Now, one thing this doesn't mean yet, we haven't seen a big jump in deaths or hospitalizations yet. We have seen an increase in hospitalizations, but it's not huge or crippling yet. I apologize, I did not check the hospitalization numbers before I got on here, so I'm just going to look at these real quick. Our deaths are still at 1 average per day. Yesterday, there were 0 new deaths reported. Okay. Now, we always remember from last year, we remember that deaths and hospitalizations go up, about 2 weeks after a big surge in cases. When cases go up, 2 weeks later, hospitalizations go up, and then 2 weeks after that, deaths go up. Now, hospitalizations are up today. 151 people currently hospitalized. That's not a problem for the hospital system. That's not the point, right? We don't start having problems with like hospital overcapacity or whatever until we're in like the several thousand range. Okay, that's not the problem. The problem is it's just indicating the severity of the disease. There are 151 people who are sick enough to have to be hospitalized. That's 8 more than yesterday, but it's 58 more than a week ago. Okay. So some number of those people won't make it. So, we might see a slight increase in deaths 2 weeks from now. If we don't, great, right? If this current surge in cases is in younger people or in vaccinated people, which is possible, some of these positive cases might be in vaccinated people who don't get very sick because they're vaccinated, right? And if we get a surge in cases but no surge in deaths, fine, great, that's fine. Nobody's going to complain too much about that because people aren't dying. We will, but if we see hospitalizations go up, which we are, you'll also see more long-term effects, right? Death is not the only outcome of COVID, right? You can have serious long-term health effects without dying, not to mention the financial effects of being hospitalized. So all of these things make me concerned about how the numbers are looking right now. We did tick up slightly in vaccinations, 51.3% of us. That was 51.2 yesterday. Have gotten one shot, and then 48.9% have completed. That means, over half of Wisconsin, which is, roughly about 3 million people in the state, have not been vaccinated. And a significant number of those are children who can't get vaccinated, right? So the rest of us should get vaccinated to protect those kids, right? Now we should be getting the variant update today. I haven't seen it yet, but we will. It hasn't. Oh, no, it has been updated. Looks like we have 120 Delta cases identified. There's certainly more than that. And that's just a small percentage. I'll get these numbers updated. We'll have a full update of variants for you tomorrow. It's not too bad. Doesn't look too bad for variants, but I'll get to the rest of that tomorrow. Okay, so that's COVID. Let's talk about some other news right now. The Next Level Southside Music Festival was canceled last year because of COVID. They have decided to go ahead with it this year. They made this decision before this recent spike in cases, so this might change. But it's going to be headlined by Kinfolk and a handful of other local and regional acts. Madison's a festival town, right? There's tons of music festivals all summer long. Most of them are on the east side. Most of them are populated by white people. So Clyde Gaines took it upon himself to create the Next Level Park Street Music Festival for black folks on the south side. Everybody's welcome, of course, but this is one's kind of geared toward that Park Street south side crowd. It's Saturday, August 7th, 3 to 8 p.m. It should be a lot of fun. Also, while you're there, you can get vaccinated. They're going to have a vaccine clinic right there for you. So check that out, August 7th on the parks on the south side of Madison. And if you go to Madison365.org right now, you've got the whole thing there. Oops. You got the whole story there with all the details, all the acts, all the times, and everything. Dane County is now accepting applications for grants to do the sort of racial equity work. That is, it's the Partners in Equity, racial equity grants. Individual organizations can apply for $15,000 grants to address systemic racial inequities in health, education, employment, and criminal justice. And if you want to partner up or collaborate with 2 or more organizations, you can apply for $50,000. This is a county program that was first piloted back in 2015, so it's been going for several years, and it's something that local nonprofits, businesses can apply to get in on. The Madison Metro School District, I mentioned this briefly, has announced that masks will be required in school buildings this fall. School starts September 2nd for some students, September 3rd for everybody. And masks will be required inside school buildings and on buses for students and staff. No mask required during outdoor activities or while eating and drinking. 3 feet of physical distancing will be required when possible. Buildings will be clean throughout the day. There'll be other practices, hand washing, respiratory etiquette. I like that idea, respiratory etiquette, and monitoring symptoms. So that's kind of a big deal, I think, that they're going to go ahead and have school. Schools will be open, but everybody will be masked up, and because those kids can't be vaccinated, right? And, could be an issue. Finally, and that's all the local news we have for you today. I'm going to take a short pause, 30 seconds. So when I come back, I'll be talking with Nusaiba Mizan. Again, this is part of the new news lab that we're part of up in Northeast Wisconsin. The Green Bay Press-Gazette did a whole series on affordable housing. And this article in particular is about how lack of affordable housing directly causes homelessness. Right. So we'll take a short pause. You'll notice I will change my shirt during the next 30 seconds. I'm not actually changing my shirt. This is actually, I recorded this interview on Friday. So I'll be back on the other side after this word and an interview with Nusaiba Mizan. And joining the program today, Green Bay Press-Gazette reporter Nusaiba Mizan. How are you doing today?
Doing well. Thank you for having me.
Oh, yeah. Thanks for being here. Give us your time to talk about this really important story and really good reporting out of Green Bay on affordable housing and its effect on homelessness. Now, this is part of the new news lab, which is a collaborative effort that we're involved with your paper and a couple others. And you all have been tackling this whole affordable housing issue for a couple of months now. And your contribution is, well, why don't you tell us? Tell us about this story, where it came from, and sort of just give us the broad outline of it.
Sure. Yeah. So the series is Unaffordable, No Place to Call Home, which looks at different lenses and issues within the affordable housing crisis. In essence, that there is a shortage of affordable housing for people at different income levels, but especially those at low income levels. This latest article that came out in the series that I wrote with contributions from my colleagues covers housing and homelessness in the area with the large number of homeless families in the area. It kind of looks at kind of the different complex issues that contribute to homelessness that a family might be facing, and then also looks in a community perspective, ways the community can address and prevent this homelessness and this trauma happening in the first place to these families.
When you tackle an issue like this, what's really important and what you do in this story is to kind of humanize it with the actual stories of real lived experiences of people, but also with the sort of institutional statistics and things like that. So could you tell us, first of all, you kind of anchored this on the story of Tavalin Love. Can you tell us her story a little bit?
Yes, Miss Love is a Green Bay resident, has been here for decades now, and this is the really first time she's had this level of challenges with finding housing, with different barriers such as like low credit history, just a criminal conviction from more than a decade ago, and as well as eviction history. And so she's finding that, despite working very hard, working multiple jobs, presenting herself and being transparent about kind of what her situation is, she's finding trouble finding housing for her and her family. And Ms. Love has, contacted landlords, maybe as soon as they put up an ad in Facebook Marketplace or Craigslist, and has even gone through application processes as well, only to get denied. And this has been the situation since September for her. So that's nearly a year living at friends' homes, in her car, at hotels, and just facing this ongoing challenge. Despite working hard, despite being a working mother, and being a community member in this area.
Now, her story is obviously compelling, and it's representative of a lot of other families. Do you have any sense as to how many families she represents? How many homeless families there are in Green Bay right now?
Yeah, for sure. Miss Love is not alone. There are, by a January count, say for example, a point in time January count. So January 2020, there were more than 200 households that were homeless, whether sheltered or unsheltered. And with recent interviews that I've done with area housing advocates, my understanding is that that number is higher than it was in 2020. So what we're seeing is an increasing number of homeless families in this area. The pandemic has definitely exacerbated a lot of the challenges that these families are facing and the issue at large.
So what are you talked about the specifics of Ms. Love's situation, a history of credit problems, as well as a criminal conviction, even though it's old, even though it's a long time ago, it's still kind of getting in the way. What are some of those sort of institutional and systemic issues that are just kind of become barriers for people?
Yeah, a lot of landlords are not even willing to consider you, or maybe they'll consider you, but then just deny you on the basis of credit, on the basis of like a criminal background or misdemeanors, on the basis of eviction history. In some cases, it doesn't really matter how long ago it was. So people can be, in a different situation in the present day than they were a long time ago. They could be, working hard to improve their credit. They could be, working hard to build those community connections and build up savings, and still have to answer to something from a long time ago. And that doesn't account for, a lot of other, I guess, like other lenses in which you can look at it that this article doesn't quite go into, such as discrimination based on race, or such as being discrimination based on like having a federal housing voucher recipient. There's just a lot of different bases in which you can find barriers.
That's what I was going to ask next. Actually, is are there racial disparities in this, and is it harder for a homeless Black person like Ms. Love to get out of that than it is for a homeless white family, for example? Do you have anything on that?
Certainly, yes. It is much more difficult for a person of color, or like like a Black family, to navigate the situation. In that the statistics, there are statistics and anecdotally to kind of support this. Ms. Love was talking about, calling and finding out that there are no vacancies, but having somebody else call, or a friend call, who isn't Black, and finding that they are saying, they're agreeing that to open the units, or that there are vacancies for that. And so she's under she shared, and under this has found that this is there is a racial disparity in housing
Yeah.
as well, anecdotally, and then also statistically as well.
Well, we also know this is a systemic thing. We also know that Black and brown people are just more likely to be convicted of crimes, even if they don't commit crimes at a higher level. They're just more likely to be convicted and get longer sentences. So if a conviction affects your rental prospects 10 years later, like that's just going to affect people of color more easily, I guess. So what do we do about it? I mean, you talked about you talked to some advocates, you talked to some homeless shelter type folks. What do they think needs to happen to alleviate this issue?
So there's, I guess, like on a community-wide scale, for
Mm-hmm.
example, continuing to implement or starting to implement uh, solutions that center around this housing first principle, this principle or this idea where first you need to ensure housing for someone, get a roof over their head, quality housing for someone, in order to address any other issues that prevent them from achieving housing, or address any other, I guess, just short-term or long-term barriers that are preventing them from achieving housing or securing stable housing. So basically taking a housing first approach rather than, I guess, addressing other problems or expecting them to fix other problems. Because it's kind of hard to do that. I'm sure it's even for the families who are homeless, for their children to focus in school or to just lead productive lives if you don't have housing. So implementing these housing first solutions is really critical. I found from housing advocates in the area that mixed income housing, or the idea that like having housing developments where people of different incomes and different different occupations, basically a diversity of families and a community, and building those strong community connections, like extremely critical to housing stability and just the stability that comes from just having neighbors support you. And that's something that a lot of homeless families are denied. It's this kind of like this loss of being in a social network when you lose housing as well. And then from an individual standpoint, obviously landlords kind of examining how they approach housing as well is worthy of mention.
That's really, really good insight. And are there any institutions, Brown County government, City of Green Bay, that are amenable to this whole housing first idea? Is that going to actually be implemented at some point?
Yeah, I think that there are leaders and advocates from who I've talked to who are really focusing in on how to implement a housing first principle, or how to better implement it. I think that it kind of comes in tandem, or comes with all these other issues and challenges when it comes to securing an area or construction, or all these different things when you think about kind of like building mixed income housing, or the I guess the details aspect of it as well. So that's kind of what's the challenges. It comes in tandem with a lot of other housing issues that we're facing.
Yeah. Our listeners might remember a couple of weeks ago, we published a story about Milwaukee actually succeeding in reducing its homeless population. And it was the housing first thing that was kind of the driving force. And that it used to be that you have to go to a shelter first and do a bunch of case management, and then get into transitional housing, and then eventually get into apartment. And they're just saying, no, we're just going to put you in an apartment now. And then we can work on all those other problems. Right. Is that kind of what these folks are describing, right?
Yes. Yeah. The idea that, like figuring out kind of the physical or the material, like security, before expecting to all this like long running complex issues and dealing with those.
That makes so much sense. And I hope it's as successful in Green Bay as it has at least begun to be in Milwaukee. Nusaiba Mizan, we really appreciate this reporting. It's really important, and we really appreciate you giving us some time today.
Thank you for having me.
And thank you to Nusaiba Mizan for joining us. Really important reporting. I put a link to the story in the comments because it published a couple of days ago and has fallen off the front page. But do take the time to read that story. It's really important work up there in Green Bay. So we appreciate that. Now, I wanted to address Bobby. Had a question about going back to vaccines, how to persuade people to be vaccinated. you're never going to convince, right? People who are anti-vaccine, right? You're just never going to. They'll figure it out for themselves when they get sick, or they won't. And I think they're a relatively small, vocal, obnoxious, possibly, but small group of people. So going up against the anti-vaxxers isn't necessarily going to move the needle just because it's not that many people. You ask about marginalized groups. I don't know how you identify ethnically, but it is inappropriate for me to try to go convince a black person to get vaccinated. It's just not. It's not something I would do. All people, just generally speaking, are going to trust their in group more than their out group, right? That's how humans are. We trust and know people who are like us. The medical system, the healthcare system, and the government of this country has earned the mistrust of people of color, especially black people. So I'm in no position to walk up to a black person and be like, no, you should trust the government. It's fine. Trust the healthcare system. It's fine. They need to hear that from other black folks. They need to be in a space surrounded by black people. That's why, like the Southside Music Festival we talked about a minute ago, was going to have a vaccine clinic there. That's a place where a black person would be more likely to get vaccinated, right? So we got to create those opportunities, right? That's the idea. It's not for us to go up to them and convince them, and because then it's going to come off as judgmental. It's going to come off as we know what's best for you, right? That's just not the right way to approach it. The better idea is to create opportunities for people to be surrounded by people they trust, people like themselves, and to be sort of among people they trust, and take that step at that point. Does that make sense? I don't know what that means exactly for you. I don't know what your position is, or whether you're in a position to actually create anything like that, or do anything like that, or support anything like that. But if you see an opportunity to support it, please do. Share the news. Share as much as you can. Share the story that we wrote about the Southside Music Festival. Put that in your social feeds. You could, frankly, you can donate to Urban League, YWCA, Urban Triage, Black-led organizations. It doesn't have to be you doing the actual thing on the ground necessarily. You could turn up and volunteer at places like that, where you're welcome, where you're invited. But I think, if you know that the Urban League of Greater Madison, for example, it has been doing a whole bunch of these kinds of things. Right. Tonight, for example, you can go to the Mallards game in Madison. If you go there from 5 to 7, it's starting right now. You can get a vaccine and a free ticket to the ball game. Like, that's the kind of thing you could call Urban League and say, how can I help? Can I volunteer? Can I donate? That kind of thing. Right. We white folks sometimes have an urge to jump in and help. It's called white savior, right? And it's not always helpful. Like, it comes from a good place, but sometimes we get in the way. When I was a little kid, my dad and I asked my dad to help at a home project. Sometimes he would say, the way you can help me right now is staying out of the way. And that's a lot of what happens with white folks. Sometimes the way we can help is to stay out of the way, and support from out of the way, with money. That may not be a satisfying answer, but that's where I stand. That's where I stand on it. And I appreciate you asking it very much. That is all I have for you tonight. I appreciate your sticking with me. It is past 5. It's a beautiful night out. I hope you get out to enjoy it. We'll be back tomorrow. I'm heading out of town for the weekend, so the update tomorrow will be a little bit early. It'll be closer to like 2 o'clock, 2:30. As soon as we get the data from the state, we'll do an update a little bit early. Until then, take care, and we'll see you soon.
This is 365 Media.